Hello, everyone. Welcome to the Love to Live Healthy show with author and weight loss specialist Josephine Fitzpatrick. Our focus is weight loss and losing it with healthy and clean living. Join us every week to hear answers to questions from our clients all over the world who text and email thousands of weight loss questions daily. Listen and learn how Josephine answers questions to help you lose weight, eat healthy, and feel great.
Hi everyone, welcome to the Love to Live Healthy show. I'm Josephine Fitzpatrick and this is my co-host Jenna. Hi Jenna.
Hello.
So today we are talking about menopause, peri-menopause, and post-menopause. Everything you need to know about menopause, right?
Yes.
Okay, and there's so many questions when it comes to that. It's such a big topic right now.
Oh my gosh.
But before we get into that, I would like to remind you that if you like this video, to please reach down, give it a thumbs up, because if you do that and you subscribe, it really helps our channel grow in the most significant way. So thank you. Okay, so who's our special guest?
We have Dr. Marina Kuperman, and she specializes in gynecology.
Awesome.
So who better to have and to talk about menopause with?
Without a doubt, yes.
It's so important, and I want to ask you, Josephine, what do your clients say to you or ask you about menopause?
Oh, okay. So they don't really ask me, they more imply this.
Right.
They'll come in, and especially with weight loss, it's always, I can't lose weight because I'm in menopause, or I, haven't gotten my period in 6 months, so I definitely can't lose weight now.
Yeah.
And that's a big topic,
Oh my God, yeah.
It's really one of those things where it's definitely, you can absolutely lose weight, and I want to speak to the doctor about this.
Oh, yes.
But,
yes.
you definitely can lose weight. It's just a matter of your body's running slower. So it definitely is harder, but it's doable. And we always have to remember that it is temporary. And another thing that we have to remember is, once you get through it, your body does go back to a more normal state where you can start to lose again. I've seen clients before, during, and after, and you do end up losing. It's just a matter of, you have to get through that period of time.
And that's great to know that it's not forever.
It's not forever,
that,
yes.
can inspire you to get through it, so
Absolutely.
I really like that.
And a lot of times we have to remember, sometimes it's more about just not gaining at that time of your life.
Yeah.
Because sometimes what happens is you're basically, working so hard, you're not losing, but you're not gaining. And if you weren't working hard through menopause, you would be gaining. Okay, so that's the difference.
Oh, that makes total sense.
Yeah, so that's what I think is really important, but I'm excited to talk to her and go over some questions that I know clients would love to know about.
Yeah, so I think now it's time to welcome Dr. Marina to the show.
Great. Thank
I
you.
love it. Welcome to the show.
Yes, absolutely welcome.
We are so excited to have you. So my first question, and it could really guide us into the conversation, is the difference between peri, meno, and postmenopause.
Okay, so perimenopause is basically the transitional time. It's the time around when women start to experience changes in their menstrual cycle. Menopause begins when you haven't had a period for 12 consecutive months. So let's just say that you've always had a regular cycle, it's always been consistent, and you've always had a period monthly, and then around the age of maybe closer to 45, you start to see changes in your cycle, meaning your period will sort of be all over the place. When I was training back, when I first became a nurse practitioner, I once heard a doctor refer to it as a term in baseball where the game is sort of inconsistent prior to the end of the season. So I remember that analogy. And perimenopause is basically your period starts to have changes in the interval between your cycle. So that can last for a while. That can last for several years before someone actually goes into menopause. So again, perimenopause is the time in which women, usually after 45, around the age of 45, they start to experience issues related to their cycle. Then menopause is considered the time of which women do not see a period for a period of 12 months. So if you haven't seen your period in a time span of 12 months, that's menopause. Postmenopause occurs for the first 2 to 6 years after you've reached menopause. So that is postmenopause is those first years right after someone has not had their period for 12 months.
Okay.
Makes
Okay,
sense.
I have a question for you. As you're talking, I'm thinking, when does peri start? Because I have to tell you, it seems to be younger and younger, or clients just think that they're going into it younger. And obviously with weight loss, it's the first thing is, I think I'm starting menopause. And I'm like, no, you're not. You're like 25. But it's just when you can't lose weight, you tend to blame things. And I know that's a big thing. So when does it generally start, peri?
Perimenopause generally starts after the age of 40.
Okay.
Can someone go into early menopause? Yes, of course. Nothing is impossible. So
Right.
there is a chance that someone may go into early menopause in their early 30s, or can can it happen that it will start in your 20s? Very unlikely. So
Right. Right.
usually perimenopause will start probably around the age of 40.
Okay.
But everyone is different. So as I've mentioned before, it all has to do with our ovarian function, how our ovaries function, and everyone's ovaries function differently. And so menopause is the start, basically it's the start of the end, so kind of to
Okay.
say, it's the start of the end of a woman's reproductive age, and it all has to do with the function of your ovaries, in correlation with the function of your pituitary gland. Again, everybody is different, but typically this starts around the age of 40,
Okay.
closer to 40.
That's what I would have assumed for most people.
Yeah.
I know everyone's different, and of course, you always have the far and few between that can start earlier, but generally it's around 40. Okay.
I
Yes.
think we should relate this to bloating because we got a lot of comments on the last video
Uh-huh.
about bloating and how to reduce bloating, all of that. But bloating is a big topic with your clients.
Yes,
Now,
absolutely.
are we bloating more through menopause? Is that what's happening?
Bloating is one of the common symptoms, I should say, of menopause. Does bloating directly correlate with menopause or perimenopause? No. There can be other factors that contribute to bloating. The primary one being diet. Yes, there are changes in our hormones that happen during menopause. These changes of hormones change the way that our metabolism functions. So essentially, our metabolism slows down after menopause. When our metabolism slows down, there's increases in certain symptoms like bloating, hot flashes, mood swings, genitourinary symptoms. All of these things kind of, one thing affects the other, affects the next. So it becomes a sort of snowball effect. Bloating is a very common symptom of menopause. Can we say that everyone who experiences bloating is going through menopause? No. It can be directly related to other factors as well. So you first have to see what else is going on, exclude all other factors, and see what is the true cause of the bloating. But bloating is a common symptom related to menopause.
Yeah,
Okay.
definitely.
What about plant-based? Now, there's a lot of studies that have shown plant-based diet, even plant-based supplements that will help you through menopause, and kind of get your body back to more of a natural state. Do you find any of that to be true, or have you know any studies about it?
I am an advocate for plant-based supplements. I've seen a lot of different things. A lot people use a lot of different measures to sort of calm down the symptoms related to menopause, because they can get quite annoying. Women are very often, my patients complain of symptoms related to menopause, and they truly affect their way of life, whether it's the hot flashes or the mood swings or the night sweats or the bloating. These symptoms can be very, very difficult to manage. And I am someone who I always like to refer to or use or suggest, recommend to my patients the least of the the least medications or supplements or things that can be used to treat certain ailments that have the least amount of side effects. So, when it comes to plant-based supplements and plant-based treatments to help with symptoms of menopause, I'm a big advocate for it. I think that a lot of my patients do very, very well with the plant-based medications. Also, I've seen a great success with the topical, the medications used intravaginally, sort of that contact medication versus the systemic. But to answer your question about the plant-based, I always try to start there. That is kind of my go-to when it comes to my patients, because some patients need a lot more or more intense treatment to deal with the symptoms related to menopause, but also a lot of patients do very, very well on plant-based medications without having to bring out the big guns, so to speak.
Right.
Because you have to remember that this is a temporary, usually a temporary issues, temporary side effects.
That's what we
They
talked
do
about.
go away.
Right. Yeah.
Yes.
We just talked
So
about
Yeah.
that.
yes, so the medications and the treatments, whether it's plant-based or women, a lot of times ask me, "Will I be on this forever?" No, absolutely not. This is not to treat something that is long term. This is just to help you get past this short period of time, hopefully short period of time,
Right.
that you're experiencing these issues, to help you feel more comfortable during this time.
Right. That makes so much sense. And we were speaking about that before we came on with you. I said it is temporary because I do notice even clients that struggle losing weight through when they're going through menopause, post-menopause, they tend to start losing again, and they actually, your body obviously doesn't go back to the way it was before, but as far as weight loss, absolutely you can continue to lose weight, and they feel great after. It's just going through it, sometimes is the most difficult part, I would say, for most people. I just want to know about the menopause, because this is a big topic. Okay?
Oh my gosh, yes.
Because what happens a lot of times, clients will come in and they'll say, my weight redistributed. I used to gain weight in my lower half, now it's all in my stomach, and it's always when they're going through menopause. So, is that a thing, the menopause?
Menopause.
The menopause is a term that is used to sort of it's a pot belly related
Right.
to menopause, to do with the distribution of fat in certain parts of the woman's body, in the woman's abdomen. So women, generally women who are not in menopause, everyone tends to have a different body structure. Everyone, even when we're young, even when we're in our teens and our 20s, some women are more larger around the abdomen, some women around uh, the lower part of their body. Some women gain weight upper body. Everybody's weight distribution is different. And so some women tend to see this little pocket of fat that develops after menopause that is more visible and more noticeable once they reach menopause, because the not to say that the distribution of fat has changed, but we can accumulate or increase the fat in certain parts of our body. And a lot of women experience that generally in the abdominal region. So that's where the term menopause came from.
Right.
So if some women notice that, well, I didn't have this little belly when I was in my early 30s. Now that I'm in menopause or over 50 or close to 50, I see changes in my body. I see changes in the way that I look. My clothes don't fit me the way that, maybe not even going back to the change between, let's say, you're 50 and 30, but even 5 years ago, women will often tell me, I never had this little pouch before. I hear it referred to as a pouch all the time. So it has to do with weight distribution and the distribution of fat cells. But it is a thing. It is common that women typically develop more fat cells in that particular region.
Well, I think it's interesting because as you were speaking, I'm thinking, you also have to remember most women, and I do see a lot of women, and a lot of times I will tell them, well, your lifestyle has changed a lot since you were 20 and 32 when you did have the flat stomach. You're not doing the same things, you're not eating the same way, and that does, of course, maybe you didn't gain it there when you were younger, but now that you're older, your lifestyle has changed, you're eating different things, maybe more alcohol, things like that. You don't, and probably a lot more sedentary with work and home life. So I know that does play a huge part in it.
Those are all factors.
And and I do think at the end of the day, I do see the clients that do lose the weight and the belly goes down because it is fat. So if you're losing fat, it's going to eventually lose from there. So do not let menopause discourage you.
Yeah,
because
it's temporary.
You can absolutely get through it and lose weight. Any suggestions on how to get through it, the best way possible for our clients that are going through this?
Yes. My recommendation is always to take. I always say, I have this phrase that I say: you have one body, and you need to take care of this one body the best way that you possibly can.
I love that.
The body will go through different stages of development from the time that we're born. Our body grows and develops. We go through different stages of physical development, emotional development, cognitive development. So those changes don't stop at a certain point in our life. They continue. And menopause is one of the types of changes that women go through. So to answer your question, it's very important for women or anyone to take care of their body in general, to help yourself once you reach that point, that menopausal or perimenopausal or once you reach that age, you want to go into it having the best possible ammunition, so to speak. You want to have the healthiest body that you can have, and it will help you in the long run. So of course, with menopause, or not even with menopause, you should stay on top of your mammograms, the bone density scans, because we do lose bone density in menopause. These are risks, and these are issues that are related to menopause. But to get through menopause, you want to go into it with a healthy mindset, with a healthy body. Take care of, make sure that once you start to, because I know we all think that when we're young and we're healthy and nothing really bothers us, we all think that we will be that way forever. And then one day things just start to slowly change. And then we wonder, well, what's going on? I didn't feel this way in my 20s. Of course you didn't feel this way in your 20s. Your body is different. Your emotions are different. Stress plays a huge factor in our hormones. So there are a lot of different things. Issues with health, such as thyroid issues and all of that stuff. So you want to sort of get everything, you want to get your body fine-tuned. You want it to be a well-running machine going into menopause, so that the issues related to menopause will be much, much easier to deal with once you're there.
I agree 100%. That's wonderful advice. Thank
That
you
was
so
really
much.
great.
Well, it was wonderful having you, right?
Yeah,
oh my
thank
gosh,
you
great
so much.
information. Thank you so much.
Yeah, that was awesome. Yeah, it was so great to have you, Marina. And I'm just going to close out by saying, if you like this video, give it a thumbs up. If you have a topic you want to be discussed on the show or a question you want answered, you can email innovationweightlossmedia@gmail.com. If you want to shop the food store from Innovation, you don't have to be a client. You can shop online. You can shop in store in Woodbury, opening in East Hampton soon. Super exciting.
Yes. And I just want to say, before we sign off, because I love how she closed out the segment. Do not be discouraged by menopause. I really do believe that if you go into it, like Dr. Marina said, you will feel so much better about going through it. It's not something to be discouraged. You embrace it.
Of course.
You'll get through it, and you can still have and feel the best you possibly ever felt for a lot of people. So, I just don't want people to be discouraged by it, because I do think it's another experience in our life. And, if you embrace it and treat it like another, positive thing, it will, really help you. Like you said, get through it and feel good about it, and, be healthy. That's really the most important thing. Be healthy, love to live healthy. That's what we're all about.
Healthy.
Yes.
I love it.
So, okay, thank you so much.
Thank you. Have
Everyone
an
have
amazing
the best week.
Thanks for listening to Love to Live Healthy with Josephine Fitzpatrick. We hope you'll pass along our web address, innovationweightloss.com, to your friends and colleagues who are looking to lose weight by eating clean and living healthy. Be sure to check out our archives section on our website for previous podcasts. Join us next time for another edition of Love to Live Healthy with Josephine Fitzpatrick. The content in this podcast is not intended in any way as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding weight loss or any medical condition or treatment, and before undertaking a new healthcare regimen. And never disregard professional medical advice or delay in seeking it because of something you have listened to on this podcast.